Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good morning, everyone. Welcome to this week's webinar. Our topic today will be discussing on contagious disease, Islamic and Malaysian perspective. Alhamdulillah, today, 29th of Sha'ban, and tomorrow, most likely, we'll be starting our fasting for this Ramadan this year. We are very delighted to have Prof. Hashim Kamali, founding CEO of International Institute of Islamic Studies, IAIS Malaysia, and also Dr. Dalila Roslan, who is a public health medical expert, Ministry of Health, Malaysia. I think welcome Prof. Kamali and also Dr. Dalila to this webinar discussion today. Prof. Kamali?
Thank you.
Yes.
Okay. Contagious disease existed during humankind's early days, but the shift to agrarian life thousands of years ago created communities that made epidemic more possible. Ta'un or plague and wabah or pestilence commonly occurred during the times of Prophet Mohammad SAW, his caliphates and the succeeding Islamic empires. Since first being recorded late last year in China, the COVID-19 coronavirus has spread around the world and been declared a pandemic by the World Health Organization, WHO. As for today, 210 countries and territories around the world have reported a total of 2,588,458 confirmed cases of COVID-19 and a death total of 180,042 deaths. Perhaps, Prof, can you share with us this contagious disease from the Islamic perspective?
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Yes, I will discuss the Islamic perspective from three parts. First will be a little bit of the history, as you mentioned. The second will be the instructions that we have in the sources of Islam, mainly in Hadith, on waba, in ta'un, on contagious disease, plagues, and pandemics. And the third aspect will be the Islamic ethics with regard to disease and hardship that befall Muslims generally, and what are the adab, the etiquettes of Islam with regard to these events. Yes, in Islamic history, there has been many instances of waba in ta'un. Of these two words, waba is the more general. Ta'un is pandemics more specifically. Waba is sometimes used with reference to other calamities like natural calamities, but ta'un is more specific. There have been 5 instances of pandemic disease in a short period of 1 century under the Umayyads. Back in history, this was the remnants of Justinian Plague, the Justinian Plague that occurred in 6th century AD, before Hijrah, just before Hijrah, and claimed 35 to 50 million people. Also, it occurred in Syria, in Iraq, in Islamic territories. The first of these was al-Shirawai, which occurred in Madain and mainly in Persian territories. The emperor of Persia, Cyrus, died. This occurred in the year 6th Hijrah. The second was Amwas, more destructive, that killed about 25,000 Muslim soldiers during the period of Omar al-Khattab. I will speak on this a little bit more, but the third of these is Jairif in the year 69 Hijrah that killed over 200,000 Muslims in these Iraq, Syria, and Egypt. And the fourth of these events from 69 Hijrah to 87, in less than in about a decade. Al-Fatayat, it's called the Fatayat, the Maidens Plague, because it occurred in Basra and the male population left Basra. What was left? Mainly the female population, its names, Al-Fatayat, mainly killed women. The fifth of these was Al-Ashraf, the nobles, compared to the oppression of Hajjaj, the Umayyad ruler of Iraq. And these were all in Umayyad periods. The history, the chroniclers tell us that under the Abbasid, the instances subsided. I comment on the Amwas that occurred during Omar's time and the responses that were given to it. He heard that a plague had broken out in Syria. So he decided to go to Syria to supervise the affairs of this plague. He went together with a large contingent of Muhajirin and Ansar, but he reached an area by the name Surg outside Medina, and there the army commander of Syria, Abu Ubaidah ibn al-Jarrah, he came and met with Omar. And Omar al-Khattab here was not sure whether to go to Syria or to return to Medina. This is because one of the companions, Abdurrahman ibn Auf, he came and told the Caliph about one hadith that the Caliph himself had not known. And this hadith is that when you hear of a plague being broken out in a land, do not go enter it, do not go into it if you are outside. But if you are outside, but if you are inside, do not go out of it. إذا سمعتم بالطاعون بأرض فلا تدخلوها وإذا دفع بالأرض وأنتم بها فلا تخرجوها. It is very clear. It is kind of social isolation practice from an early time. Abu Ubaidah was not sure. He was telling Omar, are you running away from the fate, from the decree of God? Whatever may happen, go to Syria. But Omar consulted the Muhajirun and the Ansar, and the advice was, when this hadith came to him, that was it, that was decided. And Omar, together with the Muslim contingent, returned to Medina. From Medina, he instructed Abu Ubaidah to move the troops to another area, to a more healthier region. And they moved the troops to Jabia. And then it so happened Abu Ubaidah himself died of the plague. Amr ibn al-As became the governor of Sham, and he was instructed by Umar to shift the troops to the hills. The plague was very severe, and he did that. So he separated also the healthy soldiers from the ones that were unhealthy. And they stayed outside in the hills, and after the plague had subsided, they returned to Sham, to the city areas. And then after that, the Caliph went himself to Syria, and he distributed the salaries of the soldiers personally and compensated those who had suffered most. Now, I say a few words about from the perspective of the maqasid.
Okay.
How plague kind of play out. From this perspective, the maqasid are the priorities of Sharia, the higher purposes and objectives of Islam, and these are protection of faith, protection of life, protection of rationality, human intellect, property, and the progeny. And we find that some of the instances of these maqasid, there were conflict between one or two of these. We saw instances where we could not, for example, practice salat in the mosques. We also see that people cannot go to Umrah because of the instructions that have been given. There is, this instance is not total conflict, but the priorities is given to life over religion. And we see that it is the plague is the COVID-19 is affecting the business world very hard, very severe. It is clouds is spreading over the institutions of capitalism, and it so happens that it is affecting the wealthier people more, because the poor doesn't much have to lose. So maybe we don't know the end of the story. What is God's wisdom in this? There were at a time just recently, the climate discourse was gaining traction. Now it's become a forgotten topic. It so happens that the earth is healing. They say in Penang the dolphins are coming back, the Klang River is being cleaner, and so on. So it seems to me that there are things that we do not know. Or what is the end story? Perhaps we would know in time. But here, the priority of maqasid, protection of life, come into conflict with protection of mal, and we mm, take, we give life absolute priority. And all the other instances of maqasid become secondary. In a real sense of the maqasid, it is not really religion, it is life. Without life, religion cannot be practiced. This is rather dogmatic. I think the example was given supposing the non-Muslim army attacks Muslims. It becomes the duty of everyone to sacrifice their life, because therefore religion becomes first. But in a real sense, it is life. Without life, really everything is upside down. But these instances of conflict, again, from the Maqasid point of view, are not absolute. There are, salat is still possible. We can practice it at home. Um, Also, if there are ways that we can practice, for example, uh, give opportunity to these other aspects of mal and religion. Uh, Supposing the MCO that we have uh, in Malaysia comes to an end, there will not be a rush, for example, to start the congregations in mosques. It is possible to practice this social isolation even in the mosque, to limit the number of congregations. For example, even in the mosque, people can stand apart, 1 meter apart, for example, and to, for example, perform salat in a staggered way, 2 or 3 instances of jama'ah at the same salat time. Also, it is possible to practice online bazaars. There is no objection to that. We can practice the maqasid sharia in different ways. And there are no, the sharia is open. And when you look at some of the legal maxim that instances, this is a darura, what we are practicing, what we are experiencing. Darurat tubihul mahzurat. Necessities make the unlawful lawful. But then we also read that الضرورة تقدر بقدرها, that necessity is measured according to its own true proportions. But when necessity is no longer there, the situation must return to normality. Then we have the second perspective of the instructions in the sources of Islam on waba in ta'un. I have already given the brief account of history we had. But also there are one or two other hadiths that at-ta'un shahadatan likulli Muslim, that a plague is like martyrdom for every Muslim. If you look at the third hadith I'm just reciting, then you will see the fuller picture what is meant. And say that any Muslim who stays at his home when the plague breaks out, فَيَمْكُسُ فِي بَيْتِهِ صَابِرًا, he stays at his home, now stay at home, patiently, knowing that our fate, life and death in God's hands, that لا يصيبه إلا ما كتب الله, nothing will touch him unless it is with God's permission. If he does that, he stays at home, he remains patient, and he is faithful, then كان له مثل أجر الشهيد. His reward is like that of a martyr. You see, we are suffering. In fact, most of us are hemmed in our homes. People, tempers are at their ages. I somehow, find this life is not normal. For all of us, it is a kind of perseverance. And the instructions and I will have more of these in Islam, that when you suffer these, when you put up with these difficulties, you merit a reward for your patience, for staying at home, for what difficulty that befalls you. There is also recognition in the hadith to protect the animals against plagues. It says, "La yuridu mumrid ala musah." Do not take the ill affected, infected animals to the ones that are healthy. Keep them separate. The mazahib, the ulama have asked the question whether this is an advice in the hadith. Is it something mandub to do, or is it wajib? The hadith say, when the ta'un breaks out, stay out. If you are in, do not go out. Are we under an obligation to do this, or is it just an advice? From the Shafi'i Mazhab, Al-Nawawi, who is one of the leading voices of Mazhab, he at least reaches the conclusion that it is wajib. So I think that we are also bound by rational advice. And the authorities who are in charge of affairs, and they are receiving information on the general picture, and they tell us to stay at home. We are supposed to obey and to remain patient. And that is, I think, in accordance with, because the priority is ultimately to protect the highest maqasid, which is the protection of life. Again, the recognition that social isolation needs to be observed. This is present in the hadith. There was an instance when a delegation, it's a hadith of Muslim has recorded it, that a delegation from the tribe of Saqif was on their way to visit the Prophet in Medina. And among them was one person who was affected with leprosy. So the Prophet sent for him and said that I'm informed that you are inflicted with leprosy. We have taken your bay'ah and you do not need to come, so return back. At that time, in earlier civilizations, the Egyptians, the Indians, the Islamic, leprosy was considered to be a contagious disease. Now we know that it is semi-contagious. Semi-contagious only when you have sustained contact or when the body fluids of the leper person you come in touch with that, but otherwise it is semi-contagious. At that time, that was not the mentality. In another hadith, فر من المجذوم كما تفر من الأسد. Run away from the leper like you run away from a lion. Among the Muslim scholars who have taken the instructions of the hadith, Ibn Sina, who died in 4th century Hijrah, 5th century Hijrah, 11th century Common Era, in his 5-volume book on the canons of medicine, which is an encyclopedic work. He has explained the methods of social isolation. Similar to quarantine. The word quarantine is a translation of the word he actually used. He used al-arba'iniya, 40 days of isolation in times of contagious disease. This arba'iniya, quarantine, quarta, arba'in, is a Venetian translation of the word that he had used. So social isolation was advised in 5th century Hijrah, over 1,000 years ago, very clearly by Ibn Sina. Also the kind of, distancing in leaving the places where we saw it in the examples of Omar. Generally, the instruction in Hadith, there are other instructions that are also relevant. And that is one of hope and optimism. What you read in the Hadith, Ma anzal Allahu da'a illa anzal lahu shifa. God has not created an illness for which he has not created a cure. It's our task to discover it, of course. In another similar hadith, when there is a disease, God has created a cure, a treatment for it. Fatadawu. So go and seek medicine. Do not just rely on faith and prayer. So you must seek treatment, whatever disease that may be, whether contagious or normal disease. In a hadith of Bukhari, Anas ibn Malik reported that whenever a Muslim is infected with a hurt, whether it is a disease or other hardship and catastrophe, Allah will make this an expiation for his past sins. This is the language of another. A similar hadith says, mentioned in detail, that when a Muslim is inflicted with a disease or another catastrophe, a hurt or distress of any kind, even if it is a prick of a thorn, Allah subhanahu wa ta'ala will make this an expiation for her from her sin. This is the language also of hope and encouraging Muslims to remain faithful and to seek cure and treatment. Visiting the sick when the time of illness is one of the strong advices in so many places. Ayadatul Mariz is a chapter in Bukhari, Muslim. It is something that it features in the hadith that three things are among the akhlaq of a Muslim. One is to accompany a funeral procession, the other to visit the sick, and the third is to give salam. Visiting the sick is a kind of a requirement of the Muslim akhlaq in relationship. Is part of the ukhuwa, the fraternity among Muslim, not just Muslim, but ukhuwa is of two types. Ukhuwa Islamiyya and ukhuwa Insaniya. The Prophet ﷺ also visited non-Muslims when they were sick. You know that he visited Abu Talib, his uncle, on his deathbed. He was not a Muslim. The Prophet also visited a Jewish boy who used to serve him. Then he fell ill and he went to visit him. And he also invited him to embrace Islam, and he became a Muslim. And then there are instances that he has done the same to neighbors and people that he has heard of. It's the third aspect of the Islamic teachings and ethics that we have is on cleanliness. We have now the advice of washing your hands and keeping care of the environment where you are. But this is also part of Islam. You read in the Quran, Inna Allah yuhibbul mutatahhirin. Wudu in cleanliness is a part of our faith. In the language of Hadith, at-tuhuru shatrul iman, that cleanliness is a part of the iman of the faith of a Muslim. A Hadith that is reported from Aisha, the widow of the Prophet, that the Messenger of God would wash his hands whenever he had occasion to eat or to drink. Interesting. She says it twice. إذا أراد أن يأكل أو يشرب غسل يديه ثم يأكل أو يشرب. That, okay, washing hands before you eat food, it is common in after. But before you drink, this is something the Prophet has done. I guess sometimes when you drink without a vessel with your laps or bottom, a stream or something. So he did that. In another hadith, when the Prophet had occasion to sneeze or he was unwell, he would put his cloth or his hand on his mouth so as to stop the splash of the sneeze and to reduce his loudness. This is the practice that the Prophet himself had done. It becomes part of the akhlaq of a Muslim, and we know that. In another hadith, Muslim has recorded, the Prophet has instructed, "Ghattul ina'a wa awkus siqa," cover the utensils and the vessels, and also close the water tanks and the water bags. This is something because there is a possibility that illness and disease may befall it and you will become ill. Another aspect of cleanness that occurs in the hadith is the instruction, whenever you wake up from sleep, إِذَا إِسْتَيْقَظَ أَحَدَكُم مِّن نَوْمِهِ, do not dip your hand in a dish until you wash your hands 3 times, because you don't know when your hand moved when you were asleep. And this washing of the hand, it becomes a part of the etiquettes and the advice of Islam, keeping care of the cleanliness of body in attire. This is something that is a part of the faith. It is not accidental that that one of the Muslim learned figures, Abu Zakaria al-Razi, were known to in the Muslim English language Razis, who died in 925 AD. That was 5th century or 4th century Hijrah. So he wrote several recipes for soap making. Soap was made in European countries from animal fat, but it was bad smelling. And it was the Muslims who made pleasant smelling soap. And also, he discussed the disinfectant effects of alcohol. Um, and this was not known before. So Harun al-Rashid, he instructed when he established the first Muslim hospital in Egypt in 805 AD, that is 1200 years over ago. He instructed for alcohol to be used as a disinfectant, and from there the practice then spread to Europe in other places. And lastly, among the etiquettes of Islam, one should not forget that there are people who make sacrifice and take risk. The frontliners, we must be grateful to them. Like the Arabic saying, "La yashkurullaha man la yashkurun nas." One who does not show gratitude to people will not show gratitude to Allah subhanahu wa ta'ala. I think that I have more or less discussed the subjects, the three aspects of contagious disease and the etiquettes of Islam that I wanted to discuss. I will stop here. Thank you. Assalamu alaikum.
Okay, thank you very much, Prof. Kamali, for very enlightening discussion and sharing with us. I think what I think the current government, in particular, I think in Malaysia and the rest of the world, I think if we were to go back to what being practiced by the prophets and also by the caliphates and also some of the Quranic verses and tradition, I think we are very, very, I think, following the traditions and also what's the Sharia and Islamic teaching has been asking us. Can we move to Dr. Dalila? Dr.
Yes,
Dalila?
Assalamualaikum.
Okay.
Yes.
Okay, Dr. Dalila, we are now aware that emerging and re-emerging infections have become a significant worldwide problem on contagious disease have shaped our history. From the historical and medical viewpoints, perhaps you can share with us the status and development of contagious diseases in Malaysia and the impacts on our population. What are the measures and practices undertaken by the government and the Ministry of Health to minimize the transmission of contagious diseases in Malaysia, especially in the case of COVID-19 that we are now experiencing? Over to you, Dr. Dalila.
Okay, thank you so much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. I would like to say thank you so much for inviting me. And I think that it's a very pertinent topic of discussion because we're not just focusing on COVID-19 per se, but we're looking at it, in general in terms of contagious diseases. And with regards to your first question, the status and development of contagious diseases in the perspective of Malaysia and how it impacts on our population. I think before I embark on that question, I think it's very crucial for us to actually understand in terms of contagious diseases because it's interesting to see that when the question is phrased in such that how it impacts our population, but actually when we talk about contagious diseases, it's actually how one of the factors, meaning the population, the human itself, as the factors, the determinants in how do you say, in actually affecting this development of contagious disease. Okay, just allow me to make it even more clear. When we talk about contagious disease, we know that the determinants can be divided, the triangle of epidemiology, where you have the factors of the microbial agent itself, meaning the virus itself or the bacteria itself. And then you talk about the human host, whether there's a susceptibility to infection and also talking about the demographics and human behavior. And we also link it to international trade and travel, and also intent to harm maybe, and also maybe occupational exposures. And sometimes nowadays we also link it to inappropriate use of antibiotics. So these are the factors which could actually be the one underlying disease emergence and re-emergence. And another factors, apart from the agent, the host, which is human ourselves, meaning the population, we also look into the human environment. So we also talk about, climate and weather, the changing of the ecosystem, and also we can't run away from economic development and land use. And also, we also look into the poverty and social inequality, and also in terms of the lack of public health service, for example, animal population, war and famine, and lack of political will. These are among factors which actually could actually result in development of contagious diseases. So coming into the context of Malaysia, when we understand this triangle of epidemiology on how contagious diseases may evolve, it's interesting to also note that in Malaysia, perhaps if you go back to 1997, up down the road to 2007, we have had a few um, viruses or diseases which is actually quite unique to Malaysia. Among others are, for example, Nipah virus, if we were to remember, in 1997. Yes, so that's actually named after, it's actually only in Malaysia, Nipah virus, and that was actually discovered. Interestingly to note, at that point in time, it was linked towards the introduction of animals, which is bats, and also whereby you can actually see that there's a possibility of the virulency or the transmissibility of that virus to other animals, such as we know, the pigs was, how we have managed to curtail all the pigs at that time. So this was one of the example. But actually, if you were to look at research that come about after the discovery of that Nipah virus, it's interesting to also note that it was also linked towards climate changes, because they were saying, or research have shown that there's a possibility prior to that emergence of Nipah virus. What happened to Malaysia is that we were experiencing drought. It was El Nino at that time. So because of that climate changes, what happened is that it actually causes these animals to actually come out from where they are staying. And that's when, um, the exposure of these bats to orchards of fruits. And then it was also linked to our animals that we, our livestock, or in this case for Nipah virus, it was the pigs. So that's one interesting fact that we can see on how certain viruses or certain diseases emerge. Okay, as we move along, there's also cases of chikungunya. We can also see that chikungunya in uh, which it started around 1997 as well, and it also had re-emerged again around 2003. So these are examples of viruses or diseases that's been re-emerging, emerged. And if you were to look back at maybe 1 decade, past of this 1 decade, or just recently, we talk also about cases like polio. So, we've been glaringly affected by COVID-19, when Malaysia, as we all know, has been hit hard by the re-emergence or resurgence of polio disease. Ever since we've been freed or declared as free from polio in 2000, whereby our last case was in 1992. But interestingly as well, we can note that these are factors which we can associate with also the human population in terms of how the modification of or the behavior of human, because we can link it towards refusal of vaccination that's been arising, and an issue that's been something that we have to address in our country as well. So that's one thing with regards to polio, that we can also link towards the factors that brought about this re-emergence of disease in Malaysia. So um, apart from that, we can also talk about uh, with regards to COVID-19, um, as we all know, the the source of it. Initially, it started in Wuhan, and they link it towards the animals at from the live the wet market that very exotic animals. So that's one point. But I think what's really striking for COVID-19 per se is actually how we talk about globalization and the linkage of infectious diseases. I think this is very interesting because um, I came across this review, which was actually dated 15 years ago, and it actually talked about linkage, which of globalization and infectious diseases, and this is something that was talked like nearly a decade ago, and it's actually um, being seen, or the effect can actually, we are witnessing it now, because as we all know, because of globalization, which can be defined in many ways. The lawyers would define it differently. In terms of politically, it will be defined differently, but in terms of health, we can actually understand that it's where um, advances, despite extraordinary development of countermeasures, in terms of diagnostic, therapeutics, and vaccines, and the ease of the world travel. So, how everyone can fly and everyone can be in one place in just few minutes. I can be in Indonesia, I can be in Singapore. So, this actually increased global interdependence have actually added layers of complexity to containing these infectious diseases, and that doesn't just only affect the health but also economic stability of our society. So with regards to this globalization, if I can just go a little bit more in terms of how it's affecting us, it actually, one, you can see it actually impact the speed of infectious diseases are being transmitted. Just looking at coronavirus virus itself, initially we were quite thinking that I honestly thought that it may not come here, because as from experience, SARS, it just stopped at Singapore, and later on um, um, we can see that it is not as extensive as this coronavirus, but unfortunately, because of this worldwide travel, and as we say, globalization, where everyone can actually move from one continent to another, uh, this infectious diseases are being transmitted as a result of increased amount and also speed of population mobility. So like you said in the first question, how is the impact on our population, but actually we're looking at it the other way around. How the population factors are actually impacting our spread and our development of contagious diseases. And apart from that, we can also see that potential capacity to detect disease outbreak has also quickened due to the advent of global communication and technology system. So in this case, because of our industrial revolution, because of our mass media, because of our rapid, fast-paced use of technology, we are also experiencing whereby we are able to detect outbreak faster than ever before. And also, at the moment, what's also important is we are dealing with event-based surveillance with the advancements of technology to address, rumor surveillance, in comparison to also the use of our indicator-based surveillance. Okay, having said that, another interesting point of view is that if you were to see, is the cognitive dimension of global change. What I mean by this is that how globalization can actually affect on how we perceive it, and it rises from the proliferation of individuals with institutions with global reach, meaning that how we can actually um, influence others, with which are concerned with the production of exchange of values and also beliefs and knowledge. So in coronavirus, just you can see how in Malaysia we have to combat not just the virus, the infectivity of the virus, but we also have to combat the infectivity of the viral news, and this actually causes panic among our citizens, and at the same time, it also may cause um, im- it impedes perhaps some of our management in curbing the virus. So these are things that actually goes about along with the globalization, and also with the very strong, powerful influences of this, what we say as a cognitive dimension of global change, which can be done by mass media, the think tanks, the research institution, the religious group, and now with Facebook and Instagram, we also have influencer, or maybe celebrity influencers. So these are people whom could actually shape as well the progress of what's happening in our country in Malaysia. So with regards to that, I would also want to focus now on um, our measures and practices that has been undertaken by the government and the Ministry of Health to minimize the transmission of contagious disease in Malaysia, especially pertaining to COVID-19. But before I focus on COVID-19, what's interesting for me, in the public health point of view, is that we have actually been dealing with outbreaks. Like I said, we talk about Nipah virus, we talk about polio, measles, but actually our bread and butter in the public health aspect is actually um, dealing with outbreaks. So interestingly, only when the when COVID-19 is becoming the limelight here, starting from last year till up till present, we see that actually whatever measures that has been taken to combat or to curb this contagious disease of virus is something that we have been doing. I'll give you an example. Yeah, for example, we know that our dengue cases are still ongoing. Yes, and dengue cases very closely related to coronavirus is a virus that um, uh, actually needs prevention of modification of behavior to actually prevent it. And what we're looking at similarly to coronavirus right now is the same thing. We're asking people to go back to basics. We're asking people to stay at home. These are something that comes with behavior modification or attitude. Same as dengue, we know that dengue does not have any vaccination for it. We at the moment, yes, same as coronavirus, we are still in search or in the progress of research for its vaccination. We also know that, for example, dengue does not have a specific treatment for it. It's mainly supportive, and most importantly, we know that uh, because of the vector is the Aedes mosquito, we know that a person cannot be selfish, and they have to actually ensure that their compound or their house is clean, um, in order for them not to affect other people. So it's the same concept as coronavirus. You see, the prevention is when you stay at home, when you practice social isolation, you practice social distancing. That's when we are uh, being able to actually cut the transmission. So it's very interesting actually to see all this, and it's just that because of coronavirus is a novel virus, and how the virulency and how it's affecting the world as a pandemic, uh, that everyone is actually suddenly back to cautious of what are the basic practices. So having said that, back to the question of what have been undertaken by the Ministry of Health, specifically on contagious disease, I would like to highlight that for a few decades already, we have a very strong surveillance system in part in our in Malaysia system, which actually a lot of people does not notice this. But you see, whenever the public goes to hospital, even I think among the health staff, we 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 may miss this, knowing that there is such a surveillance system that actually occurs specifically for infectious diseases under the mandatory notification system for infectious disease. So the process is that whenever the public goes to the hospital and been diagnosed by the doctor at the clinic or at the hospital, say for example, you're diagnosed as having measles or dengue, the process is all healthcare professionals must, under the Preventive and Infectious Disease Act of 1988, must notify these cases to the district health office. And that's when the process of prevention starts. And this is something that I've been wanting to elucidate to Malaysian people, and because it has been in order, and what we are doing for COVID-19 is actually something that we've been doing for other infectious diseases. So what happens is that when notification is being received at the district health offices, pejabat kesihatan daerah, the health inspectors there, the epidemiology officer there, or the officers there will actually then go and investigate the case. So this is where we also have, under this notification system, an updated infectious diseases case definition. So this case definition is actually very specific to the public health aspect, that actually focuses on how do we actually say that it is a case. And it also has meaning that, for different cases, like for example leptospirosis or measles, they have very specific definition which allow the public health side to actually see whether does this fit the case definition. And from that, of course, hospital normally would do laboratory investigation to confirm the cases, but not necessarily for all diseases. Sometimes even just clinical symptoms, we can actually say that it's a confirmed case. So these varies according to the cases, but again, it goes back to our system through this infectious diseases notification system. So with regards to that, when we have established that there are certain cases, and if there's more than one cases, normally then that's when we actually declare or say that there's an outbreak going on. So with that, then the next step would be is to carry out the prevention process. So the prevention process normally entails upon us and the health clinics team, which we call the rapid response team, to actually go and carry out further investigation, which is in this case to do contact tracing. So that's when we actually proactively go and find the cases. So for example, when we have like outbreaks of influenza or mumps in a school, in a boarding school, for example, that is when we go there and we actually screen all the students who are exposed there. So this is similar to what we're doing for coronavirus. So what the example that I'm showing is actually the same thing that Malaysian government are practicing or implementing for our coronavirus. So basically, if you were to look at this, you will realize that all are in place. Our surveillance system and the way we handle COVID-19, we have been actually upgrading our case of definition. If you notice, initially, the way we say that a person is under investigation for coronavirus was just bounded by that 6 countries. If we remember, the beginning of the COVID-19 COVID-19. So it was focused more on those who came back from Japan, from Iran, from Italy, those six countries, Korea. But after a while, the proactive measures that was done by Malaysia is that we actually evaluate, and from that evaluation we actually improve. So in order for us to catch a wider group of people and to ensure that we do not miss any coronavirus cases, what we have done is we have broadened that case definition. So that's one thing that perhaps we need to acknowledge the thing that we have done in Malaysia in order to combat and prevent this virus. So what we have done is we have actually made it to a bigger definition in terms of whoever that came back abroad with the respiratory symptoms, then these are the person whom we treat as a person under investigation. And this is important because with this definition, then it will then bring us, to decide whether these people need to be screened or not. And later on, when we also realized that we had this group of mass gathering in Sri Petaling, um, from there we had also expand the case definition in terms of we need to screen whoever was involved in that um, mass gathering. So you can see how it evolves, and again, this is something that's dynamic. This pandemic is very interesting and it's very unique in the sense that coronavirus is evolving and a lot of research are ongoing because we are still learning about this virus. So that's basically talking about how we are managing our infectious diseases in general and specifically on coronavirus. Apart from that, I would also want to focus on perhaps the last part of the question, which is we know that now at the stage of this movement control order and epidemiologically we have passed two incubation period, um, and so far it's showing positive trends. So pertaining to the flattening of the curve and in terms of the new cases and recovery rate and fatality rate, so we can see that so far I would say that if you were to ask how well Malaysia is managing the COVID-19 crisis and what is more important is how or what is the next strategic exit plan and step down approach that should be taken to win this battle. So I think in summary, to conclude my part here, I think in terms of how well Malaysia has been doing, I would say that we have shown by numbers that our recovery rate, it has reached 60%, more than 50%, as we can see in general. So far, coronavirus have been showing that the recovery rate is good. As long as it's not morbid, the elderly, inshallah, the recovery rate is good. And if you were to look in Malaysia, we can see that so far we have mounted up to 93 deaths, which only attributes up to 1.68% of fatality rate. So this is also a good sign that we should highlight in Malaysia. And we can also start to see the impact of the three phases of our MCO that's been in place, because we can start to see that the numbers are reducing. However, this should not be a benchmark for us to be complacent, because we can also look at from history and from other countries, when the removal of MCO is being done abruptly. For example, in the 1918 Spanish flu pandemic, they actually did a research in between all the states affected in the US, and they can actually compare that for the state that actually lifted the MCO abruptly, without waiting for the numbers to really reduce down. They can actually show on the graph that there's research of cases of the coronavirus. So we don't want that to happen to Malaysia. because we have been doing quite well at this moment in time, even though we do notice that there are clusters being identified. But I would say the clusters that's been identified is because of our proactive detection and active case detection. And the minute that we actually notice that there are cases among the community, we actually don't wait. We also enforce our EMCO, and from the EMCO we also strengthen our preventive measures by doing more targeted screening towards the community. So I think that's the good thing that we've been doing well for Malaysia. And apart from that, the good thing about Malaysia is that from the very beginning, we do not disregard the foreigners. I think this is actually crucial to be highlighted as well. Perhaps neighboring countries are not in line. We might see that some of the countries are discovering foreigners
Can I shift
clusters,
to this now? Oh,
but for
oh.
Malaysia, but for
Okay.
Malaysia, we do notice that we have been
So
addressing the foreigners from the very beginning, that we identified that they were in the mass gathering. So they are being screened for free, and also being treated and
okay,
isolated as well for free. So
okay.
lastly, just to, if
So
I may
can you
conclude,
just
Dr. Azam.
can you please finish your few lines,
Okay.
few
All
words?
right.
Okay.
So my few, I think the last part is actually, talking about what is the next step. So the next step, again, it goes back to the behavior modification, and as we can see that, we, in order for us to be prepared to let loose our citizens, after this MCO, we need to go back to what are the things that actually is important in social distancing. So I would say that the four important things that we need to avoid in order to make sure that our social distancing works effectively is to ensure that our community understand that we need to avoid crowded and congested places. We need to avoid being in confined spaces. We need to avoid the physical contact, and we also need to avoid the communication time, of being communicating with one another. And having done all this social distancing to be actually complement with the proper personal hand hygiene, like hand washing properly, the cough ethic that was highlighted by Prof. Kamali just now, to carry out all this social distancing together with the basic of personal hygiene. And these practices should be part, once MCO are being lifted. And for me, the strategy of the government and also Ministry of Health is to look back. When we want to say, okay, you allow for example, if you want to allow for school for children to go back to school, are we able to actually minimize the risk of all these four C's? Like, are we able to minimize them from being in congested places? Are we able to minimize them from being in confined places? So if we were to do this risk assessment for each activities, or each any gathering that we want to emphasize, based on this risk assessment, then inshallah we will be able to make proper decision before we lift the MCO. So thank you so much, and
Okay,
sorry for
thank you very
taking
much.
long
Yeah,
time.
very well presentation. I'm afraid that we're running out of time, but I think we
Okay.
have a few minutes to entertain some of the questions. I cannot take all the questions here, but I think the first question perhaps I would like to address from this Mohidin Kadar to Prof. Kamali. Prof. Kamali.
Yes.
Okay, there is a question pertaining this one hadith with regard that there's no ta'un that enters Medina, and it is said it is a quite famous hadith. But now we can see corona cases increases in the city of Medina, and how this thing can be differentiated between the use of these terms adwa or infections disease, and also ta'un, what we call plague. Perhaps Prof, you can respond to this Muhyiddin Khadar pertaining to this hadith on this no ta'un that will enter Medina.
Yes, that hadith has been actually not correctly interpreted. The hadith says that there is la adwa, la hamma in 3 words, that there is no transmission of disease and so on. But the hadith goes on, the understanding is without God's permission.
Yeah.
That part is missing in the understanding, the conventional understanding of that hadith. That these transmissions and other, that there was hamma, that there is no hamma. There was a kind of superstitious belief that when the person dies and he is buried, his uh, his body and his soul, they become like a bird, a boom. What is the owl? An owl, and it flies away. This kind of that superstition was addressed. That there is no such thing like that. In La Adwa, there is no transmission of disease. All of this ends except with the permission of God, because this is the position in the Quran that no musiba, no catastrophe, and no hurt touches a believer without this being within the knowledge of Allah subhanahu wa ta'ala. It is pre-written, preordained. But when you look at the Quran, it doesn't say, it means pre-knowledge. But rationality and rational uh, advices that come in the hadith. And we do not believe in fatalism, we do not believe in superstition, and the burden, the weight of the hadith really tells us that there is transmission, there is plague, there is transfer of disease from one person to another, from animals to other animals. The Prophet himself has shown that that is the meaning of that hadith. There is
Yeah.
transmission, but that there is a preordination, an aspect of the faith.
Yeah. Okay. Thank you very much, Prof. Dr. Dalila, perhaps there's one question for you, Dr. Dalila.
Okay.
Okay. Some said that the rate of COVID-19 in Malaysia seems low because our test per million population is low also. What do you think of this? This question from Hafiz Adnan.
Okay. Again, if the way that I discussed earlier, uh, we have to look at many factors. So sometimes when we compare the rate, because saying that our testing is low, it also depends on, again, back to the population. And one more, it also depends, again, like I said, if earlier we talk about how each countries may define their cases differently. So we know that despite in the UK or in United States, despite their increase in number of cases, but we also know that a lot of people are actually being disregard of being tested because they don't have insurance, they may not fit the case criteria. So in this case, it's very subjective in one way, I would say. But for me, we have been actually increasing our testing. Up till now, it's been around 11,500. Our target is actually to do around 16,000 testing per day. So um, we are indeed trying our best to actually carry out mass testing. But again, like I said, the factors affecting these numbers, it varies across countries. So it's hard to say when you compare it. Some countries may have a bigger population, and some countries may have how they define their case definition. Because when you go back to case definition, that's very essential in the sense that, like for us, we're saying anyone with the symptoms coming back from abroad, anyone who's involved in the mass gathering, these are the people that will be screened. So this will be different from for other countries. So these are simple or very small things that a lot of people may not see or perceive or be vague about. Hence, that's why we are taking it, one day at a time as well. So that would be my answer.
Okay, thank you very much. I think we are almost ending our session for today. But before we, stop the session, perhaps, Prof. Kamali, do you have a last, perhaps a few words you want to share with the audience?
Well,
Prof.
I
Kamali?
am, yes, just to follow on the point of Dr. Dalila, I hear that it is also, the climate factor is also
Yeah,
relevant.
yeah,
That Malaysia is in the hot climate
yeah.
and the COVID virus cannot survive a certain, above a certain degree of heat. That, and also maybe that Malaysia took measures very early in time,
Yeah.
I think, that closed the borders and then the movement control order was in place. But one doesn't know. Why does it affect the United States? Yesterday, 2,700 death cases. 75 to 80% of these are the kind disadvantaged people who have this exposure. These are, the Spaniards and Africans and Black Americans. Um, those factors might be relevant, but I think that one cannot really explain that completely. As for, well, I think Malaysia is an Islamic country, and I think we are Muslims, and it equates in the akhlaq of Islam, showing compassion, the kind of the ethics come in the forefront. Now the ethical advices of Islam and the spirituality, if there is a sense and compassion, the show of that, I think those may also play a role.
Thank you very much, Prof. Dr. Dila, just one or two words before we end.
Okay, I think it's also very enlightening to reiterate what Prof. Kamali have said. We are very blessed actually to be in a Muslim country because we have very strong support. Is how our scholars, Muslim scholars, have been very brave and have been very adamant with coming out with their fatwa. And I think what we can actually see from how Prof. Kamali have also explained is all in line with whatever that we are practicing now in this country, despite whatever religion that we have or we practice. It's in line with it, and it's more of going back to the basic. And again, it's very important because we are also going back to the new norm, like we've been hearing a lot for the past few days. The new norm would be that perhaps this year Ramadan should be done, Tarawih prayer should be done at home. The new norm of like once MCO is being lifted, there's no more lepak at mama. There's no more socializing at cafes, and there's no more going to the movie theaters, window shopping at malls. So these are actually, if you were to look at it, it's actually a blessing in disguise. We're actually setting up, perhaps improving our social circumstances. So inshallah, we should embrace this, and we will be able to combat this as long as we know our responsibility as a citizen. We take it as an amanah. So when we take it as an amanah, then inshallah we will be able to practice the basics and go back to making this a new norm as a routine. Thank you so much.
Okay, thank you very much, Dalila. I think with that, I think we will end our discussion for today on this contagious disease Islamic immersion perspective. I think this is the last day of Sha'ban. Perhaps tomorrow we will begin our first day of Ramadan. I think you mentioned that this new norm, I think, never happened in our life during this, I think, our life today. That the Ramadan that we are going to experience starting tomorrow will be totally different from what we had before. Inshallah, tonight we will be beginning our Tarawih that will be solely taking place at homes with the father mostly the leader of the house will lead the Taraweh. And I think this is something that I think we are going to face. So there will be, I think, very likely the celebrations of Eid will also be different these times. I think there will be something that we never experienced. But this is something that we are going to face with this new norm. And on behalf of IAIS Malaysia, we would like to thank again Professor Kamali and Dr. Dalila for having your time with us, and I think in this interesting and very important subject. I think salam Ramadan al-Mubarak, selamat berpuasa till we meet again in the next event. Assalamualaikum warahmatullahi wabarakatuh.
If there is no leader in a male leader in the house, a woman can also be an imam.
Yes, please. Yeah, Prof. Yeah, sure. Okay, thank you.
Okay, thank you.
Assalamu alaikum.
Assalamualaikum. Thank you.
Okay, I think we can go off there.
Yes, Prof.